There is a door frame in your house right now. You walk past it 20 times a day. You never think about it. But after today, that door frame is going to become the most important 3 minutes of your entire evening routine. And I am not exaggerating. What I am about to show you is something most urologists never talk about, most general practitioners never check for, and most men over 40 have absolutely no idea is quietly working against them every single day. It has nothing to do with your testosterone levels. It has nothing to do with your heart. It has nothing to do with your age. It has everything to do with a group of muscles you have been tightening, shortening, and compressing for decades without realizing it. And those muscles are slowly choking off the blood supply to the one area of your body where blood flow matters most. Stay with me here because what I am about to walk you through today could genuinely change how you feel when you wake up tomorrow morning. 2 simple movements, 3 minutes, a door frame. That is it. No equipment, no gym, no pills, no prescriptions, just your body and a door frame you already own. And by the end of this video, you will understand exactly why this works, exactly how to do it, and exactly what you should feel the very first time you try it tonight. I am Dr. Olivia Brooks, board-certified urologist with over 14 years of clinical experience. I created this channel, Urology Education and Vitality, because I got tired of watching men walk out of clinics confused, frustrated, and without real answers. My goal is simple: give you the information your body has been waiting for, explained in plain language, backed by anatomy, and designed so you can actually use it starting today. Now, before we go any further, I want to ask you a quick favor. If you are watching this and you find value in what I share, tap that like button right now and hit subscribe. It helps this channel reach more men who need this information, and honestly, the next video I have coming builds directly on what you are learning today, so you do not want to miss it. Also, drop a comment below and tell me where you are watching from. I love seeing how far this community reaches. Whether you are in Texas, Toronto, London, Lagos, Sydney, or anywhere in between, say hello. Let me know you are here. All right, let us get into it. Let me start with a story because I think this will hit home for a lot of you. A few years ago, a gentleman came into my office. I will call him Richard. Richard was 63 years old, retired engineer, healthy guy by most standards. He exercised a couple of times a week. His blood pressure was fine. His cholesterol was managed. He had been to his primary care doctor 3 times in the past year. He had seen a cardiologist once. He had even visited another urologist before coming to me. Every single one of them ran labs. Every single one checked his testosterone. Every single one looked at his cardiovascular markers. And every single one told him the same thing. Everything looks normal. Maybe try a prescription. Maybe it is just age. Richard sat across from me and said something I will never forget. He said, "Dr. Brooks, I refuse to believe that my body just decided to stop working. Something is wrong. I can feel it, and nobody will tell me what it is." So I did something none of the other doctors had done. I asked him to stand up. I watched how he stood. I watched the curve of his lower back. I asked him how many hours a day he spent sitting, and then I asked him to try a simple stretch. Within 45 seconds, his eyes went wide. He looked at me and said, "I can feel blood moving down there." What just happened? What happened was simple. Richard's hip flexors, muscles he had been tightening for over 40 years of desk work and driving and sitting on the couch every evening, had been compressing a major artery, and nobody had ever thought to check. That moment changed my approach to patient care. And today, I am sharing exactly what I showed Richard with you. Let me explain the anatomy here, because once you understand what is happening inside your body, everything clicks into place. And I promise I will keep this clear and simple, because you do not need a medical degree to understand your own body. At the front of your hips, there is a group of muscles called the hip flexors. The main ones are the iliopsoas, the rectus femoris, and the tensor fasciae latae. Now, do not worry about remembering those names. What matters is understanding what they do and where they are. These muscles connect your lower spine and pelvis to your upper thigh bones. Their job is to lift your knees and flex your hips. Every time you sit down, these muscles shorten. Every time you stand up, they should lengthen back out. Simple, right? Here is the problem. If you spend the majority of your day sitting, and let us be honest, most of us do, those muscles never fully lengthen. They stay in that shortened position for hours at a time, day after day, week after week, year after year, decade after decade. By the time you reach your 40s, 50s, or 60s, your hip flexors may have been in a chronically shortened state for 20, 30, even 40 years. They are tight, they are stiff, they are pulling on your pelvis, and they are compressing everything around them. Now, here is where this connects directly to your erections, and this is the part that almost nobody talks about. Your femoral artery is one of the largest and most important blood vessels in your entire body. Think of it as the main highway that carries blood from your heart down into your lower body and into your entire pelvic region. This artery runs directly through the hip flexor region. It passes right through the area where those tight, shortened muscles live. When your hip flexors are chronically tight, they create constant pressure on the surrounding tissue. That pressure compresses the femoral artery. Not enough to cause pain, not enough to show up on a standard checkup, but enough to reduce blood flow to your pelvic region by a meaningful amount. And what do erections require more than anything else? Blood flow. Strong, unrestricted, consistent blood flow. So picture this. You have a garden hose running through your yard. The water flows beautifully when the hose is open, but someone places a heavy rock on top of it. The water still flows, but it is reduced. It is weaker. It takes longer to fill anything up, and the longer that rock sits there, the worse it gets. That is what your tight hip flexors are doing to your femoral artery. They are the rock on the hose, and they have been sitting there for years. But wait, because this gets even more important. Tight hip flexors do not just compress your artery. They also pull your pelvis out of its natural alignment. When those muscles shorten, they tug the front of your pelvis downward, creating a position called anterior pelvic tilt. You might recognize this as that slight forward lean or excessive arch in the lower back that many men develop as they get older. It feels normal because you have had it for so long. But it is not normal, and it is causing a second major problem. Your pelvic floor muscles, the muscles at the base of your pelvis that are directly responsible for trapping blood inside the erectile tissue during an erection, these muscles depend on your pelvis being in its correct neutral position to work properly. When your pelvis is tilted forward, those pelvic floor muscles are under constant passive strain. They are stretched in a way that weakens them. They cannot contract with full force. They cannot hold blood where it needs to stay. They are mechanically disadvantaged every single hour of every single day, and they have been for years. So now you have two problems happening at the same time. Reduced blood flow into the pelvic region because of arterial compression, and reduced blood trapping within the erectile tissue because of pelvic floor weakness caused by pelvic misalignment, both caused by the same thing, tight hip flexors, both fixable with the same solution. And that solution takes 3 minutes. Let me show you exactly what to do. I am going to walk you through both movements step by step in plain language so you can do this confidently tonight at any door frame in your home. Movement number 1, the door frame hip flexor release stretch. Walk over to any sturdy door frame in your house. Stand beside it, not inside the doorway, but beside the frame itself. Place your inside hand lightly on the frame for balance. You are not leaning into it. You are not gripping it. It is just there to keep you steady. Now, step your inside foot forward into a lunge position. Your front knee should be bent at roughly 90 degrees. Your front foot is flat on the floor. Your back leg extends straight behind you, with the back foot flat on the floor as well. Think of it like a long, comfortable stride where you have simply stopped in the middle. From this position, here is the key movement. Gently push your hips forward, not your chest, not your shoulders, just your hips. Imagine someone place their hand on the front of your hips and you are pressing into that hand. As you do this, you will feel something immediately. A deep, pulling stretch running from the front of your back hip through your groin and possibly into your lower abdomen. That feeling is your hip flexor releasing. That is the muscle that has been compressing your artery for years, and it is finally letting go. Hold this position for 30 seconds. Breathe deeply and slowly. This is important. Every time you exhale, your body naturally relaxes a little more, and the stretch deepens on its own. Do not force it. Do not bounce. Just breathe, hold, and let your body open up. After 30 seconds, switch legs and repeat on the other side. 30 seconds each side. 1 minute total so far. Now here is the refinement that makes this dramatically more effective. While you are in the deepest point of the stretch, gently engage your pelvic floor muscles. The easiest way to find these muscles is to imagine you are stopping urination midstream. That gentle squeeze you feel at the base of your pelvis, that is your pelvic floor engaging. Squeeze and hold for 5 seconds. Release. Do this 3 times on each side. What you are doing here is remarkable. You are simultaneously releasing the compression on your femoral artery while actively strengthening the muscles that trap blood during an erection. Both systems are working at the exact same moment. This is why most men feel warmth spreading through their pelvic region within the first 60 seconds of doing this correctly. That warmth is blood flowing into tissue that has been restricted for years. You are literally opening the highway back up. Movement number 2. The supported deep squat hold. Stay at the same door frame. This time, face the frame directly. Reach forward and hold both sides of the frame with your hands at about hip height or slightly below. Your feet should be about shoulder width apart. Point your toes slightly outward, roughly 45 degrees. Now, slowly lower yourself down into a deep squat. Go as low as your body comfortably allows. Ideally, you want your hips to drop below your knees, but only go as far as feels manageable. If you can only go halfway down at first, that is completely fine. Your range will improve with practice. The door frame is your support system here. It takes just enough of your body weight to make this position achievable, even if your knees are stiff or your mobility is limited. Keep your heels flat on the floor the entire time. This is critical, and I will explain why in a moment. Hold the bottom position for 30 seconds. Breathe deeply, just like before. Now let me tell you what is happening in your body during this squat, because this is where most men are genuinely surprised. The deep squat position does 3 things simultaneously. First, it fully opens your hip joint, stretching the inner groin and adductor muscles that have been tight and shortened alongside your hip flexors. Second, it naturally repositions your pelvis into a more neutral alignment, counteracting that anterior tilt we talked about earlier. Third, and this is the big one, it opens what is called the pelvic outlet. The pelvic outlet is the bony ring at the base of your pelvis. Your pudendal nerve and your pelvic blood vessels pass directly through this ring. The pudendal nerve is the primary nerve responsible for sensation in the erectile tissue. The pelvic blood vessels are the final delivery system for blood flow into the area where erections form. When your hips are chronically tight and your pelvis is tilted, this ring compresses. The nerve signals slow down. The blood vessels narrow, and your erectile response weakens. The deep squat literally opens that ring in real time. You are decompressing the nerve. You are widening the blood vessels. You are restoring the final pathway for both blood flow and sensation to reach the tissue where it matters most. While holding the squat, add the same pelvic floor squeeze you did in movement 1. Squeeze for 5 seconds. Release 3 rounds. You will notice something interesting here. The squeeze feels much deeper and more powerful in the squat position than it did standing in the lunge. That is because the squat naturally stretches your pelvic floor to its full length before you contract it. A muscle that is fully stretched before contraction produces a significantly stronger and more effective engagement. You are training your pelvic floor in its optimal position, something most men never do. That is the complete routine. Movement 1, 30 seconds each leg with 3 pelvic floor squeezes per side. Movement 2, 30 seconds in the deep squat with 3 pelvic floor squeezes. Total time, under 3 minutes. Now let me tell you what most men experience because I want you to know what to look for. During the very first session, most men feel a warmth spreading through their pelvic region. Some describe a pulse or a gentle throbbing at the base of the pelvis. This is not imagined. This is your femoral artery responding to released compression. Blood is flowing freely into tissue that has been restricted, and your body is telling you it notices. In the first few days, most men report a heightened awareness in their hip flexor region. They notice how tight those muscles actually are for the first time. They feel looser after each session, and many describe a warmth in the pelvic area that lingers for hours after the routine. By the end of the first week, something many men thought was gone starts coming back. Morning firmness, that reliable sign of healthy blood flow that you may not have experienced consistently in years. It begins returning because your body is finally getting consistent, unrestricted circulation to the pelvic region during sleep. By the second week, erections typically become faster to achieve and fuller in quality. This is the combined effect of improved blood flow through the femoral artery and improved blood trapping from your strengthening pelvic floor. Both systems are now being activated regularly, and your body is responding. By the end of the first month, most men report a level of firmness and reliability they have not experienced in years. Some describe it as feeling a decade younger, and all of it from 3 minutes a day at a Doorframe they already had in their house. No prescriptions, no devices, no appointments, just 2 movements and the knowledge of why they work. Now I need to cover the most common mistakes because I see men make these over and over, and they are the difference between the routine working and not working. Mistake number 1 with the lunge stretch, not pushing the hips far enough forward. This is by far the most common error. Most men shift their weight slightly forward, feel almost nothing, and conclude it does not work. Your hip flexors are stubborn muscles. They have been shortened for decades. A slight shift will not release them. You need to actively drive your hips forward until you genuinely feel a deep pulling stretch through the front of your back hip and into your groin. If you do not feel it, you have not gone far enough. Push further. Breathe into it. Let it open. Mistake number 2 with the deep squat. Letting your heels come off the floor. This is crucial. When your heels lift, the entire stretch shifts away from your hip joint and pelvic outlet and moves into your calves and ankles. You lose the decompression effect entirely. Keep both heels firmly planted on the floor throughout the entire 30 seconds. If this means you cannot squat as deep initially, that is perfectly fine. Go to whatever depth allows you to keep your heels down. Depth will improve naturally over the first week or 2 as your hip mobility opens up. Mistake number 3, and this applies to both movements. Holding your breath. I cannot stress this enough. When you hold your breath, your entire body tenses up. Your muscles contract, your blood vessels constrict, and you prevent the very release you are trying to achieve. Slow, deep breathing is not optional. It is what allows the muscles to let go. Inhale through your nose for 4 counts. Exhale through your mouth for 6 counts. Every exhale deepens the stretch and enhances the blood flow response. Make your breathing a deliberate part of the routine, not an afterthought. Mistake number 4, skipping the pelvic floor squeeze. I know it seems like a small addition. It is not. The movements alone improve blood flow by releasing compression on the artery. That is valuable on its own. But the pelvic floor squeeze is what addresses the second half of the equation, the muscular system that traps and maintains blood within the erectile tissue. Without the squeeze, you are solving half the problem. With it, you are addressing both the vascular and muscular components simultaneously. Do not skip it. 5 seconds, 3 rounds each position. It takes less than 30 seconds total, and it doubles the effectiveness. Let me address something else I hear frequently. Men ask me, Dr. Brooks, is this going to fix everything? And I want to be honest with you because I respect you too much to make promises that do not hold up. This routine addresses two specific and very common mechanical causes of weakened erections in men over 40. Femoral artery compression from tight hip flexors and pelvic floor weakness from chronic pelvic misalignment. For a large number of men, these are the primary contributors that have never been identified or treated, and for those men, this routine can be genuinely transformative. However, erectile function is influenced by many factors: cardiovascular health, hormonal balance, neurological health, psychological well-being, medication side effects, and more. This routine is one powerful piece of the puzzle. It is not a replacement for professional medical evaluation. If you are experiencing persistent changes in your erectile function, please see a qualified healthcare provider. This video is for educational purposes and is designed to help you understand your body better and take proactive steps to support your health. That said, here is what I know from 14 years of clinical experience. Most men over 40 have never been evaluated for hip flexor tightness or pelvic alignment as a contributing factor to their concerns. Most have never been shown how mechanical compression can restrict blood flow to the pelvic region. And most have never been given a simple, practical, equipment-free approach to address it. That is what today's video is about, giving you knowledge and a tool that you can use starting tonight. I want to share one more thing before we wrap up. Remember Richard, the gentleman I mentioned at the beginning? He did this routine every single night for 30 days. He came back to my office for a follow-up, and he sat down with a completely different energy. He told me that within the first week, he noticed warmth and awareness in his pelvic region he had not felt in over a decade. By week 2, his morning firmness was returning consistently. By the end of the month, he told me something that honestly made me emotional. He said, Dr. Brooks, I feel like myself again. I did not realize how much I had lost until it started coming back. That is what this is about. It is not just about erections. It is about feeling like yourself. It is about confidence. It is about vitality. It is about waking up in the morning and feeling like your body is on your side again. 3 minutes, a door frame, 2 movements. That is your starting point. So here is your challenge. Tonight, before you go to bed, walk over to a door frame. Do movement 1, 30 seconds each leg with the pelvic floor squeezes. Do movement 2, 30 seconds in the squat with the squeezes. 3 minutes total. Pay attention to what you feel during and after, and then do it again tomorrow night, and the night after that. If this video helped you understand something about your body that nobody had explained before, hit that like button. It takes 1 second and it helps this video reach other men who need this information. Subscribe to the channel if you have not already because the next video I am releasing builds directly on today's routine and you do not want to miss it. I am Dr. Olivia Brooks. Thank you for trusting me with your time today. You have everything you need: a door frame, 3 minutes, and now the knowledge of why it works. Your body has been waiting for this. Go give it what it needs. Medical disclaimer: this video is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before starting any new health routine. Individual results may vary. If you are experiencing persistent changes in your health, please seek evaluation from a licensed medical professional.